In 2017, we put out a call for applications, and this call for applications was something that we did with Takeda Pharmaceutical Company. We are not going to talk a lot about Takeda, but just want to say that they did something amazing, which was allow us to do this program without taking any rights whatsoever, and that's been a really important model for us. It's an important way that we're following the model of what we do here as a not-for-profit, for-profit linking partnership. In any case, I'm going to ask our other panel members to introduce themselves and their roles as we go through our questions to each of them. So I'd like to start by asking Steve, if you would just give a 1-minute introduction about who you are and what your role was on this program, and then John, and then Graeme, and then I'm going to go through questions from each of their perspectives, and we're going to hit some of the really key and interesting points in this arc of time from when we first became aware of Justin's work to where we are today. So Steve, would you like to?
You notice that 1 minute? That's a Diana thing. Anyway, my name's Steve Brenner. I have a PhD in, of all things, chemical physics from Indiana University, and somewhere on the way out the door I began to do some biology. Ended up at the NIH for 10 years and then moved to DuPont's New Life Sciences effort, then to DuPont Merck and Bristol Myers Squibb when they took over that. And I joined about 6 or 7 years ago. The HDI, Diana and I happen to have a relationship that goes back all the way to when she was a postdoc, which was in a postdoctoral program at DuPont that I was running at the time. But now I work for her. So anyway, the project, that's all you need from me right now. Okay, good.
All right. So John, can you just give a very brief introduction as to your role in the in supporting the Harrington Discovery Institute's?
So my role is really twofold. I helped organize the Industry Advisory Board. Jonathan asked me to do that at the beginning of our beginning to fund scholars, and I also co-managed the investment fund that we're using to do follow-on investments in scholar companies and Accurastem as well, the companies we've made an investment in. So we look at investment on the philanthropy side and opine upon that, and we look at investment on the for-profit side, if you will, and opine on that. So I wear two hats. I put my hat on to do the IAB, and then when they're ready to go for investments, I go over and try and help manage the for-profit investments from our leverage fund, which we can talk some more about later on.
Thank you.
And I'm a virologist by training. I mean, I grew up in Cleveland.
All right, and John was the one who knew that the bus that we were on the other day was not taking the right route to the destination we were supposed to be going. All right, so Graeme, could you please give us an explanation of how you came to be on our video and sharing this luncheon with us today?
Yes, and I have to start by saying I'm very sorry that I'm not there to join with you today, but I hope you can hear me clearly enough. So my background, for everyone's interest, is as a pharmacologist. I spent many years in pharmaceutical R&D, initially in the UK, where I am right now, with Wellcome Research Laboratories, Burroughs Wellcome as they were known in the US. And after many years doing benchside research for therapeutic discovery with Wellcome, they were acquired, as I think most people know, by Glaxo to form Glaxo Wellcome, and I spent a year working with them, still doing therapeutic discovery and early stage development. And then in 1996, I moved to the Bay Area to join Hoffman La Roche, who had just acquired Syntex Pharmaceutical Company. So still with my white lab coat on, doing experiments, looking for novel therapeutics. And I think that was about the time frame that I met Jonathan through the work that he was actually doing on nitrosylation of various important receptors at the time. And we sort of stayed loosely in touch over the years. In 2003, I took off that white lab coat and joined Takeda Pharmaceutical Company on their venture side. And I essentially helped them to build, and then I ran their corporate venture outfit. I think what this sort of duality of experience has given to me is the ability to look at innovation, therapeutic innovation specifically, from both sides of the table. As a researcher, on the one hand, and understanding the complexities of everything that goes into the development, or certainly the discovery of a novel drug. And then on the investment side, understanding perhaps with a little more precision what's really required to make something commercially viable. So that's the background that I have. Through my relationship with Jonathan, I worked initially with him, actually in the origins of Harrington Discovery Institute, and then joined the Investment Advisory Board, working with John and the rest of the team several years back. And I think I view my role there as one of several people there who cast the pebbles into the otherwise smooth waters of a proposition to see if ultimately we can disrupt our thinking about that opportunity, and if not, provide the sort of guidance and advice that I think is required to help early innovation get translated to patients. Sorry, I probably took more than a minute there, Diana.
Thank you, Graeme. So here you have representing an arc of time of our interactions with this really interesting project. And I'd like to take us back initially to 2017. As many in the room are aware, there's an incredible unmet need for new therapies and new interventions in the areas of rare disease. So we put out a call for applications, starting with letters of intent throughout the United States, looking for the very best academic discovery research in new breakthrough therapies for rare diseases. And we received actually over 250 letters of intent. And one of the people who became aware of this call for letters of intent was Dr. Ichida over at UCSC. So I wanted to ask the first question to you, Justin. If you could say first, how did you become aware of this call and this opportunity? What appealed to you about applying to it? And what were you imagining at the time? Or did you imagine at the time what this would wind up, how we would wind up influencing your life from that point forward?
Yeah, yeah. Let me just say I had no idea what was to come, but it was just one of those emails, from the people at the school that distribute, new calls that are out there that people may not have seen for grants, And it was from our development office. It turns out that she has a personal connection with Mukesh, and I think that helped to really identify this one. But really, I looked at it as it came in the inbox, and it sounded exciting because it was very different from everything else. It was like, let's see if we can help you to make a therapeutic candidate, and that's totally different than what normal grants look like, but also very exciting because we worked in an area where there was huge unmet need, and maybe we had some new technology or a new target that could really help. So that's what really kind of got my attention, but I had no idea really what the secret sauce of the HDI was. The advisory committee. I had no idea that was going to come next. Yeah.
All right. So during that process, Justin's was one of 90 applications that was invited, and we went through a rigorous process of evaluating those and diligencing them. And Justin's project was ultimately selected. There were 8 projects selected during that call. And so my next question is to you, Steve, because once the projects are selected and we put together a relationship with the Institute that is contractual, then you hear from me where I say, congratulations, and as part of your award, we'd like to come and visit you with a team of advisors. And so, Steve, I tapped you and said, I've got this really interesting potential therapy that I think might be right up your alley. Would you help me with this one? Be the lead advisor and come with us to visit Dr. Ichida's lab and see what he's really got. So my question to you really is, what were your first impressions, and how, if you can recall, how did we prepare for going to visit Justin and trying to demonstrate to him that we had something to offer?
Yeah, it was a really interesting process in which we as a team back at Harrington really looked in detail at what he proposed to do. Made a list of questions for him that we wanted him to answer, and a sort of general short slide deck of what we do, how we do it. And we came in and met with Justin and his technology transfer people, and I got up and gave a short talk. And I saw Justin making this funny face. I said, I wonder what that's about. And he said, no one who's ever offered to give us money knew what we did. And you guys have a 2-page list of things you think we ought to do differently.
Right.
And it was from that it took off. Yeah. And my experience with scholars like Justin and others is, if we don't build trust fairly early, they're going to keep us boxed out of really doing what we do well. And so we work very hard at that, and those early meetings and those early calls got us to where we were intimately involved with what he did.
I remember being impressed because you were making suggestions that were great ideas, great suggestions. And you'd probably thought about this for just a fraction of the time that we'd been thinking about this. And that really impressed me that day. Yeah, I remember that.
Well, so one of the things that's a secret to having a successful project is the development of this relationship between the advisors and the scholar and the scholar's own team. In fact, we try very hard to build a dynamic where the scholar would see us, where Justin would have seen us as part of that team that we met with that day. And as the first few months went through, and we, as you mentioned in your talk, our advisors had a look at your plans and looked at this really interesting hit molecule that you had and said, how about changing that to a nucleic acid?
Yeah.
And so what I wanted to ask to you is basically, what was going through your mind as we said, yeah, we know what you put in your application, but here's some different ideas about what to do.
Yeah, it was kind of one of those ideas that once you hear it, it's like, why didn't I think of that? It just made sense from so many different angles. I think the small molecules, it's a journey. I mean, it can be a successful journey, but it's a journey to make it be able to penetrate into the brain. This particular target is expressed in all cells, so there were already some known problems gastrointestinally if you treated with some of this particular drug at too high of a dosage. So we wanted to try to avoid those things. And the suggestion to just switch over to an ASO just made complete sense because, you could directly intrathecally deliver an ASO. It stays there for a month or two and doesn't leak out at that too high of a level. So it achieves kind of addresses both of those concerns. And, there were already drugs like this in the clinic. So, that there was some precedent for that. So I think, it just made total sense, and it just wasn't, a good example of what the Harrington team brought to the table, and we just weren't thinking about it, but when you think about it, it's like, yeah, this is a great idea, Yeah.
So here we are, we're off and running. We've developed our relationships, and what we did next was to say, let's round up the team up, and Steve, what do you think Justin needs in the way of additional funding to follow up on all these suggestions that the advisory team is coming up with? So you were the person who had to go out in front of John and the investment advisory team and say, we'd like some more money for Dr. Ichida's project, and here's what we think he could do with it. And would you please give it to us? So my next question then is for you, John. You are the chairman of the Investment Advisory Board. We come in there and ask for funds to continue to support this project and accelerate it towards where we think it can go. Can you help us by walking through the inside view of what you thought about the project, and also what process do you and your team go through as you decide that you will grant our request and provide more money for this project?
So let's step back to the mission, which is to help advance these projects toward the clinic. They're none of them funded at a level enough to get them very far. It's pretty quickly apparent they need more money. So which ones should get more money and why? And so as we look at these, we're looking at, are the studies that they want to do, are the milestones they're going to hit, be something that's going to be attractive to an investor or a partner or a licensor. And we're coming at it from the perspective of, most of the folks in that committee are venture capitalists or have been in the upper reaches of pharma making these kinds of evaluations. So what we're looking for is, are the proposed experiments going to, they're obviously going to advance the project in some direction, but are they going to advance it in a direction that will be recognized by a subsequent funder or by us, by a partner to do that? At that time, Biomotive was a partner and they were looking at things, and so we kind of know what they were looking for. Will this funding, with the results of this study, a development candidate created or an in vivo study, like you did with the mice, turn the heads of investors and be something that would be investable? And that's how we kind of look at it and debate that. And then Graeme will throw a pebble in the water, and we think we've got it all figured out. So, well, wait a minute, what about this?
Right. So that's kind of the next level up of investment, and this is philanthropic investment that comes into Dr. Ichida's lab, and all the results belong to Dr. Ichida's institution. But in the meantime, here you are, Justin, you are interacting with all these folks who've been kind of raised in their drug development experience through industry. And as your 2-year term drew to a close, you were putting together a spin-out company, Acurastem. Can you tell us a little bit about how working with Harrington may have influenced your evolution, not just as a scientist, but as an entrepreneur?
Yeah, I think when you're in the Harrington program, you're really just thinking about, initially thinking about how to make this, product or lead or development candidate. But once you start seeing that that's going to happen, you start thinking about how to get it to the next level, how to get it into humans, how to get it into patients. And so thinking about that really inspired the initiation of the formation of the company, because it just seemed like that was a good vehicle for making sure that you could raise the right kind of money and assemble the right kind of team to be able to take that next step, from the late preclinical stage into the clinical stage. And that's really, thinking about that constantly during the second half of the HDI program is what really kind of led to that.
Great. And so now we're going to fast forward, because Acurastem has been continuing to develop its products based on the initial work that you've already heard about. The mouse study has been done, and in 2022, there's a new source of funding that Harrington Discovery Institute could bring to bear by investing in spin-out companies from some of our projects. So, Graeme, this brings you onto the front, because now there's a request from the company that Justin's team started, saying Acurastem would like to ask Harrington Discovery Institute if you're interested in investing money in this company. So perhaps from your perspective, can I ask you if you can share with the audience now what new level of value are you looking for in that process, and how do you look at these spin-out companies and make a recommendation on whether this investment would be a good thing to do?
So I think the transition between philanthropic funding and what we might regard as commercially value driving funding is a critical inflection, and there are very, very few, if any, other organizations outside of HDI, I think, that have the capability of providing that seamless structure for early stage entrepreneurs, early stage innovation. What we would want to do, of course, with let's call it the bridge funding that we can provide to entities that have come through maybe one or more stages of philanthropic funding, is to really now develop visibility in the biotech ecosystem more generally. And when I talk about the ecosystem, I'm talking not just about the biotech companies themselves, but the venture capital sector that obviously drives a lot of the funding there. And industry plays, as you mentioned, Diana, Takeda played a very interesting and important early stage role here, but all pharma industries now doing therapeutic discovery recognize the value of engaging early as well. And so there is an ecosystem comprising, if you like, academic early stage innovation together with the financing that's required to drive it forward, and industry who will be eventually probably the development partner for that asset, and certainly the industry that ends up marketing this drug and getting it to patients. So there's a very different perspective now that Accurastem would face when it crosses the divide from philanthropic to this commercially value-driving investment. And I think the important criteria that we need to apply at that point is to make sure that, number one, any investment HDI makes that is, if you like, taking an equity stake in that company is seen by that ecosystem as a real validation, a stamp of validation, a hallmark of value. Otherwise, we won't have that credibility, Accurastem won't have that credibility, and it would be just as tough as it ever was to raise money from the wider ecosystem. So I think in general, the HDI value proposition here is to provide credibility, validation, and an early stepping stone to gaining the sort of serious capital that's required to take a drug into clinical development.
Thank you. All right. So one more question. John, you have now a new hat that you're wearing as part of the fund manager for this investment of a portfolio of projects, and the investment in Accurastem is an important step. But I'd like you to think about, or to share with us, how you think about Harrington investment dollars in this kind of portfolio structure is going to help us achieve our ultimate mission of bringing forward new drugs for people who need them.
Well, our mission is to do that, and these dollars help support that. We're providing what I might even call, they're not subjective dollars, but they are early, more risky dollars that we're bringing to bear. So we're coming in at the very earliest stages of a company formation generally for any of these scholar programs. And as Graeme mentioned, our imprimatur on this helps them in their fundraising process. But the notion here is none of these therapeutics, these medicines, are going to make it to the clinic and to patients unless there is a commercial enterprise to do it. And so we need to, help support moving these opportunities into commercial enterprises. And we need to do that from the point of view of providing funding to the projects so that they can advance, but also funding so that we as Harrington can have a return on that. So we're taking small equity stakes, which over time will hopefully provide returns back that we can continue funding more scholars. So the notion here is we want to get a piece of everything that we can that makes commercial sense. There's going to be a lot of companies started that we may not invest in as we do the diligence, but when we do it, we want to make sure, like any good venture capitalist would, that there is a return out there that we can see as possible. So we're thinking about that return and trying to tee it up at some point for larger firms to come in and put in more dollars, and that's part of our relationship with Advent Life Sciences as well.
Great. Well, I think we want to congratulate you, Justin, on the achievements, on demonstrating a living example of what we're trying to accomplish, how we can help investigators like yourself take this journey. We're wishing you, yourself, and Accurastem the best of success. we're looking forward to next year.
Yeah.
And thank you very much for sharing, for all the panel members, for sharing this inside view of this 5-year journey we've all been on. So thank you all.
Yeah, thank you.